Welcome back to MTP. This would be number 21. Today our question comes from Chuck in California. And Chuck, this is a question that actually evades most urologists' fund of knowledge because none of us really quite get it, including myself until recently. I understood what most men were complaining about. And your question is, you say, I recently had a penile implant and I found that my pump is extremely difficult to pump. It's very hard. And he doesn't delineate exactly when it's hard to pump it and what type of pump. So I'm gonna go over all the different pumps and I'm gonna go over some of the facts about each pump and some of the facts about the physics behind the pump itself. My good friend Raphael Carrion at University of South Florida calls it pumpology, and he gives a wonderful talk on pumps and their upsides and their liabilities. So one thing that you need to understand is that every pump at end filling is going to be difficult to pump. If you've ever pumped up your own bicycle tire, you know that at end filling, it's difficult to pump the pump. So it doesn't matter which company your implanter used, Chuck, for your pump. At end filling, it's going to be very difficult for you to pump it. I can tell you that in the beginning, all pumps are a little bit more or less pliable, a little less pliable, so it might be more difficult to pump it at the beginning. But you need to find the best and most efficient way for you to pump in order to get to that end filling point where, of course, it's going to be difficult to pump at the end. It's your job to pump it until you cannot pump anymore, so you end up with a physiologic erection. So that being said, knowing that it's going to be difficult to pump, I'm going to go over basically the three types of pumps that are readily available. This is the AMS implant, and this is their pump, and I hope you can see it. And I like to use this pump for guys who have bad hands because it's a rather large pump and it has a very nice button to push in order to deflate it, so you don't have to have quite the dexterity or sensate in your fingers in order to deflate it. But it has the same pump mechanism as the other company, which we'll talk about, and its deflate mechanism is a button that you push in order to bring the pump to the penis to a detumesced state. This is the current newest model for Coloplast, which is the Titan Touch, which has basically a button that you need to depress in order to deflate the pump. And this can be a little bit more difficult than the button that you feel on the AMS, but it has a similar concept and it has a similar pump mechanism. So the third pump, which I'll have to show you using a picture because I don't have it here today in our green room or whatever you call it, is the Genesis pump for Coloplast, which has two bars above the pump, and you have to squeeze those at the same time that you're squeezing the implant itself. Now, this is the pump that I like to use because there's not one case report of that pump getting sticky. The other one-touch sort of pumps will get sticky occasionally, especially when they're not used frequently. So I'm also able to quote some very good long-term durability for this pump, where the 15-year survivability of this pump is somewhere around 87%. And that's the one that you hopefully see on wherever the screen is here. And finally, what's the best way to pump your pump? And everybody has a different technique, but what I like to describe to my patients is the thumb over thumb approach, and I hope you can see this. So you basically cradle the pump in your fingers and then you pump it with a thumb over thumb approach. Dr. Sarmiento, can you hand me the model over there? So, thank you. So with this model, you can put it in front of you and you can take your thumbs, you can cradle that pump and get used to using the thumb over thumb approach in order to maximize your cylinder filling. Because when you maximize your cylinder filling, then you get a physiologic erection. which will be, I hope, MTP number 22. We'll talk about the physiologic erection because this has been a great week for questions. So, get used to this thumb over thumb approach to pump your implant all the way up and use it and have a blast with it, and make sure when you're done that you deflate the penis. And the best way to deflate the penis is, depending upon which deflate mechanism you use, is activate the deflate mechanism, or squeeze the 2 tabs on the pump that I usually use, and then deflate the penis from front to middle to back to make sure it's completely deflated when you're not using it, because it's more sensate when you go to use it, when you have it completely deflated when you're not using it. So, all that being said, you just had a quick lesson in pumpology, and realize that, of course, it's going to be difficult to pump at end filling. That's your job. That's the patient's job. It's not the company's job. It's not our job. It's your job to make sure that it's as hard as possible. And then it's also your job to make sure that it's completely deflated. Now, this is MTP 21, and I want to tell you that we have a new addition to the Meet the Penis family, and that would be my twins. Vincenzo and Lucia have come in. They've joined the family of Dylan and Zoe and Miriam and myself. I'd like to welcome them to the world of MTP. So we'll see you next weekend.